Welcome, everyone. My name is Rory McDonald. I work with the Government Outcomes Lab. And one of the things I do is convene a group called the Oxford POGO Club. The POGO Club, that stands for Procurement of Government Outcomes. I'm here as Claire Dove's assistant. We're delighted to have Claire Dove, who's the Crown VCSE rep, chair this session, but I've got a couple of housekeeping things first. So this is a hybrid session, so we have people online and here in person. For the people online, Yuko from the GoLab is your friend. Yuko will be monitoring the chat to identify some questions for the group. And then in the room, we have Francisca. Francisca is waving, and so she will help guide us with questions in the room. But at this point, I'm going to hand over to Claire. Claire, thank you very much.
Great. Well, good afternoon, everybody, and thank you, Rory. Well, welcome to this interesting workshop, very important workshop, because we're discussing how we achieve wider well-being through public procurement. Just a little bit about me. I worked in the social enterprise sector for many years and was chair of Social Enterprise UK for a number, where one of the things that we did was support the Public Value Act to get onto the statute books, which is crucial to the debates that we're all having. So now I am the grand title of the Crown Rep for the voluntary charity and social enterprise sector. And my role is to look at ways in which central government and procurement can add value to our communities up and down the country. Social value, as you know, was we managed to get that into all government contracts 2 years ago, but there's still much to do. And at this unprecedented crisis in our country at the moment, it's needed more than ever. We spend about £340 billion on contracts each year in government. And the fact that we now have a 10% minimum in all of our contracts is a major stride forward in addressing some of the major issues of the day. But one thing that I felt in government, it's also important that we have a diverse range of suppliers. We know that the VCSE sector has the reach into our communities and create that well-being through contracting that is essential. Every pound produces the extra value that is needed to support our communities and our economy, because we mustn't miss out on the economic impetus of this work. I'm sorry that I'm not with you today in person, but as Rory said, Rory and colleagues are supporting.
This meeting is being recorded.
Is supporting me today. Sorry, I've just got a pop-up on my screen. So we don't have a finite amount of time, and so I would really like to get down to business. We have a great panel today to present to you their thoughts on the subject, and there will be the opportunity for you to have your questions, put your questions to the panel later on. But let's get it underway. Our first speaker today, each speaker will have about 8 to 10 minutes to present, and then as I said, we will have questions at the end. But our first presenter today is Raquel Carvalho from the Cataloca Research Center for the Future of Law. And her presentation, again, is essential, is how green public procurement can be produced to improve social outcomes. So over to you, Raquel, for your presentation. Thank you.
Thank you so much, Ms. Dove. I believe you can upload my presentation. Thank you so much. I don't know if I have the command of the presentation. Do I? Okay. Well, I do not have much time to speak, but I need to thank you so much for being here, to be heard for such a great audience and a great panel. And well, I have mainly two main streams to explain. Firstly, if green public procurement, that is it's very developed in European Union and in European member states, and of course also in Great Britain, can be used even when inserting environmental clauses, can be a catalyst to improve social outcomes. I will not speak precisely about social clauses or social features in the public procurement, but how can green criteria or green factors can have also social outcomes. That's the first one. And for that, I will use some experiences in member states. On the other hand, there are also social bonds as also in Portugal, and I will show you some numbers. There is some contracts that are mainly devoted to improve social outcomes and well-being in Portugal, and have some results so far. Well, of course, there are some social outcomes that are, of course, attended and through dedicated and specific social measures. Well, the clauses regarding wages and employment and non-discriminator measures and so on. Well, we are talking about working conditions, minimum wages, protection of disabled people, equal treatment, but all these clauses are most of the times mandatory for member states, linked to other directives other than public procurement ones. So we don't have here many, how can I say, many inputs in the public procurement because we are bound to obey certain rules. But there are other social outcomes, namely regarding quality of life, well-being, and health. They are that cannot be achieved with labor laws, or not only with labor laws. When we consult the buying social, the guide that has been launched in 2021, there are some some goals and some directives stating the need for implementation of social policies because they are much behind when compared with environmental ones. And the public procurement mechanisms are one of the tools that are mentioned there. In addition, the fulfillment of legal obligations, of course, may pursue social outcomes and may also, in the contract execution, where I believe these clauses are much more effective, mitigate the adverse social effects from some of the public contract execution. Please, can you move to the next, please? Thank you. Well, there are a variety of instruments to be included to implement social considerations, and well, they are listed there, some of them. The development of these tools beyond the mandatory labor and social rules are not the same, are not equal in all member states. Well, for instance, the ethic commerce or the ethic trade, for instance, is a very important issue here in Spain, in my neighbor's country. Not so much in Portugal, even though I must stress that the Portuguese enterprises and companies, not the social ones, not the voluntary ones, but the economic ones, those that seek the profit, are also very aware of the need of incorporating social responsibility in their policies, not engage already with the government and the government policies, but by their own. Okay, so some of these tools, well, have different developments around the member states in Europe. Of course, accessibility is all around, but fair employment opportunities as well. We are trying here in Portugal, at least. We are also providing opportunities for social economy and social enterprises that, well, they are not, how can I say this? It's sometimes very confusing to understand their nature, because some of them, as they pursue social interests, they have a particular status in legal order in Portugal. Others have private capital, but they are supported by some recognition from the state of their social outcomes. So they have a particular status. So sometimes it's different to put them either in private sector or in public sector. Well, sometimes it's confusing. Next one, please. This is, some examples about subject matters and examples of how the subject matter can have some social outcomes. For instance, with supply of hospital uniforms with a high value, you can see there, there was in the procedure exclusion and selection criteria to ensure that ethical labor practices along with the supply chain, for instance, or in the care service for vulnerable young people, preliminary market consultation decided on the most effective way to deliver the service. Or in public-private partnerships, the collaboration between public and private sector to develop an urban area, including social housing, for instance. The selection criteria include experience in delivering projects in a social inclusive manner. So this is three examples of how we can include some criteria that have social outcomes from the execution. Next, please. Well, here we have some examples. I must explain the colors. The colors are the inclusion in yellow of environmental factors or interests. The blue ones, or the cyan, is the social outcome, and the green is the economic outcome. So you can see that, for instance, in Basque Spain, there are, of course, linkage between environmental considerations and social ones, because they use the plastic waste and the reduced spending on bottled water, but then this has some social outcomes. For instance, the inclusion of accessibility requirements. The winner of this procedure offer bigger buttons for the identification of type of water, and the glasses are located, makes it easier to people in wheelchairs to take the glasses and fill them as well. So this is one example. Next, we have I have some examples. For instance, in Copenhagen, they fought social dumping by including labor clauses in contracts to ensure fair conditions and a minimum rate of pay, including overrides. No, you can change. I will not read, of course, the slides. We have them if you want to see in particular manner. In Sweden, for instance, some opportunities to support social enterprises, again, linking environmental considerations to social ones and to economic ones, because European Union intends that these horizontal policies, they do not go side by side. They have to be included, and they must have, they should be included in all contracts and work together. Okay, next. And funders also integrating sustainable public procurement, SPP, monitoring. The monitoring phase is particularly important in these contracts. In Portugal, we have a very discussion about this because we do not have monitoring reports about contracts executions. And the monitoring phase is absolutely decisive to see how the factors are being executed, which effects we can have from them, and if they should continue or not. I would ask you, if you please, if you go to, because there are to slide 19, because there are too many examples and I see Miss Dove. I believe she's preparing to cut me off. So this slide is important because is the connection to the other trend that I wanted to speak about, because even in public procurement, we use social impact bonds to improve learning outcomes in Lisbon. There were several contracts that were specifically devoted to social outcomes and to pay the people that have these contracts to have a certain and determined social outcome. This is okay. I will wrap it up. Okay, so please move on. So I will say I intended to show you the 23rd, sorry, because this is more, no, the previous one, sorry. Okay, thanks. Here we can see that we have from 2014 up to 2021 several social impact bonds, and mainly in education and health. This is important because we had 23 projects and 5 organizations, namely Fundação Aracan as an investor, the Healthcare System Central Administration that was commissioner and an intermediary, and a Fundação Portugal Telecom that was also an investor. The public body involved is Portugal Social Innovation Mission Unit that has led all of these projects of social impact bonds with social results very interesting and very promising for the future. I'm sorry for the times. Thank you so much for your patience. Thank you so much.
Raquel, thank you very much indeed. And I'm sorry, it is a condensed time to get so much in, but hopefully we can share the slides with the audience. But that was a great can through the European perspective. Thank you very much.
Okay. Thank you so much.
We move on now to our next. We have three presenters for the price of one. We've got Matt Illick from Catch22, Jonathan Bland from E3M, and Julian Blake from Stone King. And their presentation will cover procurement to partnership and the role of the BCSE in improving the effectiveness of public services. So I'll hand over to our 3 presenters.
You stole my jokes. I'm not really sure how to recover from that. But very nice to be here this afternoon and to kick off our 3 for the price of 1 panel. So I'll be talking even faster than a 1-person panel. And if I kind of roll the pitch and set some context as somebody who's essentially a practitioner of public procurement. So I've got a 15-year career so far, mostly in public policy and not-for-profit delivery, and almost exclusively have been working inside and outside the public sector, and almost always with public procurement. And just for some context, so Catch22 is a national charity, and majority of its income is about delivery of public services, and most of its funding is from different public sector sources. And so in the last 3 years alone, I've worked on about 136 different bids to the public sector, enumerating some kind of three-figure £1 million fund. And I'll roll the pitch for my co-panelists. So I wanted to start by saying that public services can be pursued inside and outside of government, and that's borne out in the history of this country, at least, which is before the NHS was created in 1948, before schools became the tonic of the state, before probation was delivered by the public sector. Actually, most of these were voluntary activities. And so the point to make is that lines are more blurred than they are straight, and to kind of create a discourse where it's about public procurement buying certain things from outside agents is a sort of false dichotomy, and we should look more for the porosity in some of these relationships. Public procurement itself is the means by which public value can be created. So I think Claire said in her intro that more than 250, close to 300 million is spent on public procurement in this country every year. And clearly having social value baked into the thinking around that is a major way of driving up a focus on things that matter more than just the price alone. But in the context of the voluntary sector role in public procurement, it's worth remembering that whilst it's a huge amount of money that is spent on public procurement overall, so that 296 billion, only about 5% of some 250,000 charities are active in that process. And so that's about 12,000 organizations. And they're playing with a very small subset of the overall money available. And the organizations that are playing in that space are often larger organizations. But broadly speaking, the voluntary sector is at the margins of public sector activity still, in spite of various efforts to try and move it forward. But that isn't necessarily a problem in itself. The more important thing is to try and look at the core and how these transactions work, and maybe calling them transactions is the wrong word. Public procurement is complicated, but it shouldn't be complex. So public procurement can be a practice of consistent activities that isn't about the complexity of different stakeholders and trying to bring real world outcomes into contract. It's about pre-procurement dialogue, strong approach. So whether you choose grants or contracts to bring things to being, the size of contract packages that allow certain actors to play a part, whether payment by results mechanisms are used, particularly for cash-ridden organizations, and of course, timeframes and technicality that can sometimes exclude certain actors. So the important thing to note is that that is the means by which we get to the end, and actually the complexity happens on the ground. And that is where actually there needs to be a very strong partnership that isn't just a contract management relationship, but one of colleagues trying to achieve shared endeavor. And so broadly speaking, and this is maybe one to think about in the national policy dialogue, is that there needs to be a reset between the relationship between government, private sector, business, and civil society as to how they collectively deliver public value. And it's recognizing that solutions don't rest in one place, but that monopoly of ideas can be spread out, and the open partnership is needed in the business of delivery. And I think between them, Jonathan and Julian have some strong examples and summative points as to how that might be achieved.
Thank you, Matt. And could we have the next slide, please? So, as Matt was saying, procurement needs to be seen as a tool, and it's one way of being able to engage in creating partnerships with social enterprises and the wider social economy to support public service delivery and to improve outcomes for people and communities. The problem is that it's kind of based in market theory rather than collaboration theory. And when that comes to the need for some of our social services and our most complex social problems, we end up with very transactional processes that actually stop you being relational. Despite the fact that actually under all of the current EU legislation, and we've got a new procurement bill going through at the moment, but under the current legislation, there's loads of flexibility and there's lots of things you can do to create really good relationships between purpose-aligned organizations, social enterprises and charities that really want to work with public authorities and actually have a reach into communities and have ways of participating and engaging with users that can really improve things for people. And in our work in E3M, we've been very frustrated over many years, and Julian will no doubt tell you more about that as a legal practitioner, by the fact that people don't and haven't used the flexibilities that are there. And so that drove us to produce our procurement to partnership toolkit, which is really about trying to give some comfort and help to commissioners that they can do things differently. It was interesting, DCMS, I think, published a report just last week that talked about one of the real barriers to having more social enterprise and charity delivery of public services is the capacity of the commissioners and their understanding. And we've got this big kind of cultural barrier to get through there. And so the idea of this is to help with that. But just to give you a few examples of some of the things that we've got in there, and there isn't time to go into lots of detail, but you've got the website link. If you're interested, you can go there. But some examples are Leicestershire have had a real problem with the number of looked after children, the whole children's services market. We know from the McAllister report how badly broken that market is, and people are looking for solutions. And so they thought, well, we can find a solution. We can go out, have a competition for a partner. And then once we've got that partner, we can actually co-create, we can innovate, we can co-create and invest in solutions that will really make a difference. And they did that, and they found Bernardo's as their partner. They've had some brilliant results. They're actually into the process of doing that. They did that under the light touch regime, but using the principles of a innovation partnership. We have Oldham Council, who were, I think, probably the first local authority to use the innovation partnership procedure for something social. That was about social prescribing, and again worked with local organisations to create a consortia that could actually deliver and work in partnership with the council to do that. In West Lindsey in Lincolnshire, you've got a different example where the council is working with a social enterprise P3 to tackle really terribly poor, blighted housing. That's social housing, but it's privately owned. People are living in terrible conditions, lots of houses boarded up, slum streets. They've got a long-term partnership to re-socialise that, put in street wards, make the whole thing better. And then linked to the report that was launched earlier or mentioned earlier around the relational contracting that has also got the example of Plymouth Alliance in it. You've got a really interesting long-term contractual arrangement where you've got the local authority working with 7 other local social enterprises and charities in a 10-year alliance to try and help people who have what's known as complex needs, very often a mixture of perhaps mental health problems, dependency on substances, perhaps involvement in the criminal justice system, who traditionally all get pushed from pillar to post. And this allows a relational way of bringing everybody together to get to the root of those problems and make a difference. There are some more examples. There's lots of things that can happen, but we should have so much more. And the reason that we don't is, I think, linked back to that capacity issue flagged up in the DCMS report. What those things all have in common is the alignment of purpose, the long-term nature of the partnership, the idea of kind of co-investment and co-creation and the involvement of the service users and local people in actually creating solutions that really are going to work, rather than just something that's been turned out of a procurement process sausage machine where you're following the rules, but you're never really actually making a difference. To make that happen, we need the right kind of legal framework. We've got one at the moment that works. We've got procurement legislation going through. We need the change in culture, and we need to have people with the right capacity. I'll hand over to Julian now to bring that together.
Okay, thank you, Jonathan. So next slide, thank you. So this project, the Procurement Partnership Project, is a collaborative project. It involves Matt, it involves Jonathan, it involves commissioners, it involves social finance institutions. And we are summarising the issues as 5 fundamental correctives. I'm just going to go through the 5, highlighting what we're really talking about there. This is all from a practical perspective. From my perspective, as a public benefit lawyer working with organisations like Matt's, thinking about progressive, mature social enterprises succeeding despite the system, despite the things that require these 5 fundamental correctives. The first one, commissioning shakes ecosystems. The point there is that every single meeting I have in relation to public services, we revert to having to talk about procurement. Procurement is only one part of a commissioning exercise. Commissioners have a responsibility to work out the best way of providing services within their locality. That's not just about procuring service contracts. There are all sorts of other things they can do as well, and they can focus on partnership engagements as well. Public service commissioning isn't market purchasing. It might be market purchasing, but isn't necessarily market purchasing, because public services have to be there. Markets don't necessarily deliver what have to be there. Coverage, quality, affordability, sustainability, necessary features of a commissioning ecosystem, and therefore part of something that doesn't just arrive through simple market purchasing. The second point is that purpose must drive process. Very, very simple thing to say, but it's so, and in a way, again, the procurement is the illustration of the point, because procurement for 10 to 15 to 20 years has degenerated into a process which pays little attention to purpose in a lot of cases, obviously not in all cases, but you get the process dominating to the extent of very good things not happening because procurement supposedly stops them happening. So that's a distortion of the whole thing, and is resolved if anyone operating any sort of process remembers that the process has a purpose, and the purpose is the most important thing. And this also applies to structure getting in front of purpose, or regulation getting in front of purpose. Purpose is the thing. If the purpose is right, you can address all those process, structural, and regulatory issues in one way or another. The next one is the precise subject of this session, the social value point. What we would like to say there about social value isn't just an added value thing. Social value has very appropriately become, as Claire was saying, it's been incorporated into our procurement and commissioning systems. But unfortunately, the focus is really on the added value idea, the idea that you deliver something and you add something else on the side, or you comply with something else on the side. Now, when you talk about public services, social value is the thing, or let's call it public value to distinguish from this added value concept. What you're trying to get is best value public services that actually deliver. That is social value, or that is public value. It's not just an added value concept. And added value really is, I would say, at a rather bad stage. It's very good that it's there. It's very good that everyone's looking at it, but it's become an adaptation of the existing system, so that it hasn't transformed. We try to use transformation as the language, but it hasn't transformed things. It's added something in. It itself becomes more process, to the point where we get a checklist of monetized social value things that don't actually change things and aren't actually improving things in the way that is suggested. So it's about purpose, it's about value, and value being something that is the principal focus. Thinking in terms of public benefit being central to this is a fourth point. Organizations like Matt's, it's a charitable social enterprise which competes with any commercial organization, but we might say does it better because it's purpose-driven. And the point about being purpose-driven, if you're an efficient organization, is your purpose aligned with the public sector. The public sector is trying to deliver something. The purpose-driven organization is trying to deliver something. And that's not saying you have to be a charity. It's saying you have to adopt the, let's call it the social enterprise model. You're delivering a purpose with business efficiency, thereby delivering purpose. And the next point there is one that I think really ought to be developed, and you hardly see it. The idea that there are prerequisites for any supplier of public services, or there should be, that are about being purpose-driven, are about being properly committed, as well as having the capacity and the capability, to the extent of being not demonstrably non-exploitative in terms of profit extraction, being prepared to offer your cost base, and being prepared to discuss reasonable surplus, to being prepared to operate on an open book basis. That's collaboration, that's purpose-driven engagement between the commissioner and a provider. And that leads us to the fifth point, which is really the summary of all of them, which is we're trying to talk about relational engagements, partnerships, collaborations between organizations with different perspectives. The Commission has a role to play, the provider has a role to play, the social and finance institution has a role to play, and they can all do it in partnership, and nothing is stopping that except mythology.
Thank you very much indeed, Julian. Just to our speakers, if we can try and keep to the schedule because we're now running over. So on to our next speaker is Sandra Hamilton, and Sandra is from the University of Manchester, and her presentation will cover priceless procurement, process innovation, and evaluating non-financial outcomes. Sandra, a warm welcome to you.
Thank you so much. My name's Sandra Hamilton. I'm Canada's first social MBA. I wrote Canada's first social procurement frameworks, and I'm doing a PhD. And today I'm delighted to be able to present the first review of my empirical research. So it's about people, isn't it? It's about how we look after one another. So clean air, water, the well-being of people and planet are today the things that we value most. That's very important to people. It's rising in importance, and we're certainly seeing that rise in public procurement. So what we're asking, let's be really clear, is we're asking markets for the most part to deliver non-market outcomes. And I think this slide really captures what well-being is and what we value. What's growth for? We've had a very strong focus on economic growth, but it's become disconnected from societal progress. So as Jacinda Ardern in New Zealand said, you know, what is the economy for if people aren't thriving? Positive or negative outcome, every purchase we make, and as a collective, our taxpayer-funded systems are spending trillions globally, and it has a positive or a negative outcome. That has to be intentional, has to be purpose-driven. And so central to this debate is outsourcing and how value is defined in public contracts. It's not moving. There we go. Okay. So I wrote a paper called Public Procurement, Price Taker or Market Shaper. And when I looked at these three paradigms of the history of procurement, goes back a long way, being aligned with social outcomes, back to sort of 1840 in the States. But in the 1980s, through Ronald Reagan, Margaret Thatcher, there was this move that procurement should absolutely prohibit non-commercial criteria. And we started this 30-year journey with procurement being about pursuing the lowest price globally. And it was about market liberalization, it was about outsourcing. And now I think we're seeing the rise of the sustainability agenda and looking at, can we compete in a more sustainable and innovative way, or will we collaborate our way forward? And I think we have to really think about, are we going to compete or collaborate our way forward? We're seeing countries like Japan in 2001 mandated green criteria in their public procurement. Did you catch that? 2001. The Netherlands and the UK are now mandating circularity, and social value must be evaluated in taxpayer-funded contracts. So what I thought I would do is point out that, not going. Is point out that cost saving is declining as an importance. Sustainability is rising, and resiliency has come out of nowhere since the pre-pandemic to post-pandemic. And we're seeing that in public sector and private sector supply chains. Next slide. Okay. So public value theory tells us that we need an authorizing environment, clear outcomes, and capacity. I think we have the authorizing environment. There's a lot of myths around it, but anything I wanted to do in my practitioner work for the last 10 years, we've been able to do it. It's the myth that was holding us back. So I think there is an authorizing environment. There are clear outcomes. What we're talking about now is culture change and building capacity. So my research asked, how do public managers respond to mandatory social value policies. What actually happens on the ground? And I researched the case of Greater Manchester. Greater Manchester was a very early adopter of social value procurement and thinking around social value. It is also around 20% weighting is normalized now in across Greater Manchester local authorities and regional government. At the high, it's a 30% weighting. Next year, if you want to bid on a contract in Greater Manchester, you will need to pay the living wage, you will need to sign the Good Employment Charter or an equivalent, you will need to have a credible carbon plan, and you will need to be setting aside contracts for the VCSE sector. So what have I learned? How social value is interpreted matters and affects management decisions. So if social value is an additionality in the procurement function, there will be a very different approach to management and implementation to if it is a mindset that is organization-wide. So what I'm trying to show in the blue and the orange colors is that the most transformative actors are working with strong political support, are working with strong leadership, and are working with social value being embedded as a mindset organizational-wide. The blue actors are adding on to the existing system. So where do the most transformative actors, how do they identify community need? And what they do is they talk to the people that they are most wanting to help. This is about changing lives, and for the most part, it's about poverty, inequality, and about providing opportunity to people that the current economic system doesn't work for. So we're seeing co-production of frameworks through networks like the Social Value Network. We're seeing accords and agreements bringing in strong partnerships with the VCSE sector, and we're seeing a collective definition of what is good employment. So you'll see those highlighted on the slide in yellow. In green, we see the rise of social brokerage and the importance of communication between sectors and online platforms. And that makes it dynamic. Instead of having static reports, we can have dynamic interchanges. And in blue, how that aligns with the political agendas. So we're seeing the rise of civic empathy in keeping with our keynote speaker. I think absolutely this is being driven by civic empathy, compassionate leadership, and it is drawing heavily on ecosystems as a source of knowledge. So how does that knowledge, once you've identified community need, how do you articulate that need into market signals that the market can respond to? Two approaches. There's the bottom-up approach, and where you're articulating that through charters, accords, and the procurers can look at those documents and draw from those. Or there is a top-down, which is responding to the pressure for standardized measurements. And here you're seeing the use of social value menus. My interviews said that social value menus have been incredibly helpful in providing some bounded rationality to this big undefined space, but that they absolutely need to be reflecting the local context and the local need. My interviews also said, next slide please, that there is very little support for financial proxies. So we've heard a lot about monetization. There is concern about quantification, gamification of the system, that large players can invest in the resources to do this. But by having the financial proxies, are we perpetuating the very economic system that and the dominance of the current system that we're trying to change? So absolutely loud and clear, I'm hearing from public managers, there is high concern for tying financial proxies to this process. And I'd just like to mention that in both Northern Ireland and Canada, there's a point system as opposed to a financial metric system that's being used. I'm not going to go through all these, but I would like to really point out that the public managers stressed, they think that we are now introducing competition where there used to be collaboration. And so there is a high need for collaboration and for us to design systems that reward collaboration. We need to understand the difference between equality and equity. And I think equality is, regulation, public services and what is good for the greater public good. Social value to me is about inequity. It's about putting the resources where they're needed most to give people what they need to achieve equal opportunity. So my gift for today and from all this work is that the current system is still very focused on low bid. We still have performance-related targets that are about cost savings. Transitional approach is to raise the bar and to have technical specs that add green, for example. But ultimately, it still gets awarded on a ratio of price-quality ratio. I think there's an area where we could be telling the market exactly how much money we've got and challenging the market and awarding entirely on the best social outcome for the available funds. I call this priceless procurement. I think it could foster interesting collaborations with large organizations and SMEs, BCSEs. I think it can stimulate innovative outcomes, build the capacity of the public sector to see what the market will do when it is rewarded on best social outcome and price is removed from the equation. And so I offer that as an idea. I don't think we're going to solve horizontal problems with vertical silos, which is how we've set up society today. And I think the horizontal work is where we build the strength and improve our social fabric. And I'll wrap up by saying I think priceless procurement absolutely is capable of valuing what matters most to build capacity. Let's remove price in some cases and let the market and the partnerships that we can collaborate together to move us forward with this massive amount of public money. Thank you.
Thank you very much indeed, Sandra. A very interesting presentation. So we're next going to move on. We've got two presenters next. We've got Vaishali Bade and Martin Toomey, and they're going to cover fostering innovations with social value in procurement in the healthcare sector, the NHS way. So welcome, look forward to hearing what you've got to say.
Thank you so much. First of all, introduction, my name is Vaishali Bade. I'm a senior consultant in sustainable procurement and social value with Action Sustainability. And today I'm presenting with Martin Toomey, who is NHS Supply Chains Sustainability Manager. Only one point about Martin, he has decades and decades of experience in public procurement and sustainability. So I'm sure we will hear some use cases within NHS supply chain. Starting the presentation, I think these views are mostly my own, and I've taken inspiration from different work that we are doing with public sector. And within this presentation, we are talking about well-being through public procurement. And let me start by quoting that procurement and supply chains are as complex as human bodies. So let's start with this. And what you look on the screen as of now, the complexities around supply chain, it's as easy as diagnostic. So if you go to a doctor, they will immediately give you a treatment or medicines, maybe not. They will diagnose first that what's the problem with you. They will use endoscopy, CT scan, x-rays, whatever is needed to find what is the problem with the body. And then they will give you a medicine and treatment. And that's what we are trying to do with the supply chain. We are bringing supply chain transparency because within my career, I've spoken with lots of category managers, being a procurement professional. Whenever I ask people that, do you know your supply chain? They said, yes, I know my first tier suppliers that are sitting very near to my home. But what about the sub-tier suppliers? What about the contractors who are not sitting closer to the home, but the raw materials are coming from different regions and country? So we need to diagnose the problem before giving any solution within our supply chain. So the key is supply chain transparency over here. A little bit about NHS SCCL, what we are talking today. I'm talking about the wider portfolio that we are covering. We are, of course, as the notion goes, NHS is all about medical consumables. Yes, that's true, but that's half the story. We are also buying capital equipments, diagnostic equipments, and non-medical stuff as well. And what we are talking today is from the goods perspective. We are not touching the services, only the goods social value over here. And now let's look at NHS supply chain and how social sustainability fits within their portfolio. Of course, I think most of the members over here, they have spoken about social value. So I'm not touching that point, but it's all about what we are giving back to the society, what we are doing for our local communities. But we also need to think what we are doing for our staff members, what we are doing for our employees, how we are bringing diversity, how we are bringing well-being to our own staff and our own employees. That's all about social sustainability. But going back to our diagnostic part, we understand that we do have complex supply chains. So we need to have social responsibility, which is actually social value, social sustainability, and going beyond that. If you are getting raw material from some other country, some other region, you need to follow the legalities, you need to follow the regulations, and don't forget the ethical part that we have touched in the morning as well. So social responsibility will be the key within the complex supply chains, what are existing in today's world. Can you help me with the next? Okay, so it's there. Within NHS supply chain, there are thousands of sustainability issues, risks, and opportunities. But let's apply 80-20 rule that we can't solve all the problems. So we need to prioritize. So what you see in the red box, these are the priorities that we are working within the NHS, be it the social side, be it the environmental side, or the economic side. I will not touch on these priorities, but you can see on the screen, we do have 4 different priorities in place for NHS supply chains from the goods sector. Let me define the 4 Ps for supply chain of NHS. Of course, whenever we are talking about sustainability and well-being specifically, we are talking about people, how we can contribute to the society. But just think for a moment, we are talking about people, but are we thinking from a 360-degree angle? People are my consumers, people are my clients, people can be your suppliers, people can be your local community, people can be your own staff, your own employees. So whenever you are working on the social side within healthcare sector or any sector, you need to think about that 360 angle towards the people. Planet, of course, we all know as businesses, we do create certain negative and positive impact. So we need to work around how we can mitigate those things, specifically around carbon. Profit, specifically for NHS supply chain, it's not the traditional profit that we are talking here, but we are spending taxpayers' money. So we need to spend that judiciously and more sustainably. So that's profit for me. But the 4th P, which is really important for NHS supply chain, is the procurement side. And why procurement is different for NHS SCCL? Because we are focusing on value-based procurement. Again, let me take you back to NHS. Of course, I'm sure people who are based in the UK, you have used those services. It's all about the patient care. At the end of the day, the business model, the virtue of NHS is how you are able to give better and efficient patient care. So anything what we procure within the supply chain, we think about patient care. And within our procurement, we of course, think about social value. We think about sustainable savings, but we think about how we can efficiently give better services to patients, how we can reduce their time in hospitals and still give them the best of the best services possible. So this is what we are talking about, value-based procurement. Talking about social value, again, we are talking about a complex supply chain, so even the social value will not be easier over here. So within NHS, we have 4 pillars. For social value, tackle climate change, which is mandatory because NHS is on a journey towards net zero. Reduce single-use plastics, again, one kind of a caution over here. We are talking about healthcare sector where it's not possible to actually reduce all the single-use plastic because we need to think about infection control. We need to think about the healthcare things when we are thinking about plastic. But wherever it is possible, we are reducing plastic within the supply chain. Support the circular economy. Whatever we are buying, we are thinking, can we recycle? Can we use it again? Can we actually remanufacture those items over here? Tackle modern slavery and uphold labor standards. Of course, again, the complex supply chain, sub-tier suppliers within the country, outside the country, we need to tackle modern slavery as of now. And this year, NHS, ENI, they released a social value guidance. And I can say it beautifully captures the net zero goals and the social value goals for NHS. And of course, it is available on Google, and of course, you can download and read this manual. I will just hand over to Martin, but before that, this slide is quite strong. And what we are talking about is paradigm shift. Because whatever we are thinking from a futuristic approach. We need to think about the value-based procurement. The traditional approach, if some of you are from the procurement and supply chain world, you will understand whenever we are working on contracts or bids, we always see one size fits all. Can I just replicate what I'm doing in one contract to another contract? We need to move from that approach to a prioritized approach. What are my priorities? What I can solve within this contract or tender? Second, traditional thing again, audits. We love audits. We send an auditor to a supplier and we feel like, okay, the checklist is filled, life is done, I can sit. No, we need to educate our suppliers. Gone are the days when we used to do audits, but now education and awareness are quite important.
Sorry, can we wrap up, Vishali?
Question is, and really, sorry. Okay.
Sorry, we're really running over now, Vishali, and I'm anxious that Martin gets his opportunity to speak.
Perfect, sorry. Yeah, just one last point, retrospective reporting. As the traditional reporting goes, we always think about, we have reported this stuff, how maybe 3 months or 6 months later, we can take steps. We need to move towards real-time performance management. If something is happening in the world right now, you need to solve right now. You can't wait for next 3 months, sit back and then solve it. And yes, move towards sustainable supply chain. Martin, over to you.
Okay, thanks. I'll go as fast as I can, Claire. So social value is embedded into all our procurements and is in the supplier roadmap to get to net zero by 2045 in the NHS as an organisation. Could you move on, please? So this, I won't go through these. These are just examples of where we've adopted different approaches to different scenarios in categories and applied value-based procurement to certain criteria of certain procurements that we've done quite recently. Just move on to the next one, please. Well, this is a value-based procurement case study that we've done, and this is the outcomes of it. Again, I'm not going to go through all the outcomes because we just haven't got time. It's about remote monitoring of patients with chronic conditions and obviously reducing visits to the hospitals. Again, these are more social value where we've added greater weightings in there, like the office furniture and outdoor furniture, 40% social value, and the National Uniform Framework, 20% social value, and that included a recycling option of the uniforms at end of life. Can you move on, please? This is the value-based procurement assurance framework, which we use when we develop value-based procurement projects. And again, it's on our website, and because it's a bit busy slides on our website, and this is what we're doing in terms of developing social value-based procurements. Again, could you move on, please? And that's it, I think, is it, Charlie? Questions at the end of the presentations.
Thank you very much, Martin. And I'm sorry you had to.
Don't worry about it. Don't worry about
slides, but hopefully they will be circulated. So our last presentation today is from Rory MacDonald, who introduced himself earlier, and also Dr. Claire Fitzgerald. I'm really interested in this one because the title of this is Social Value Lemonade. I need to hear more, Rory and Claire.
All right. So we are going to be very brief because I definitely want to leave time for questions and discussion. So one of the things that we're really concerned about here is transparency. And another thing that Claire's going to talk about is capacity, and this has come up a bit. Can we go to the next slide, please? Thanks. So I need to thank the colleagues at various institutions. We've worked together and produced some, learned some things and sharing insights there. So thanks to them. If we go to the next slide. These are my colleagues here. So thanks again to them. If we go to the next slide. Does this work? Let's try this. So I'm going to zip through here. So what are we talking about when we talk about the lemonade? Well, we're really thinking about insights from Akerlof, who described a problem in markets and a lack of information in markets, information asymmetry. So a lemon is a bad car, and there's a market for lemons in the absence of information, because you don't know as a buyer whether or not something's a good car or a bad car. So this price just ends up being the same. You've no information about quality. And the thing that we're concerned about is that there's a lack of information about what social value is being included in public procurement. So we are concerned that the whole social value movement and the ability to add value here is impacted by this lack of transparency. So of the 300 billion that are spent, we know very little about any social value clauses that are included in those contracts. We've talked about, there are large strategic suppliers who are making commitments in contracts, and we're not really aware of what those commitments are. There's again a lack of transparency. So this is this is how we get to lemonade. Okay. So some of the things that I wanted to point out a little bit is, what are we talking about social value? There's legislation in the UK, in England, and then there's legislation also in Scotland about community well-being and community benefit clauses. I want to draw the attention to a little bit of attention to the Scottish description here. This legislation also talks about the availability of subcontracting opportunities. I know we're going to talk about VCSEs later, but again, if we don't know that if the market is not aware that there are these opportunities or commitments have been made around social value, then it's harder for VCSEs to participate. I'm going to keep moving and pass it over to Claire, I think. Yeah.
So I suppose there's sort of a couple of major points I want to make, and then I'll talk a bit of detail about some of those. And the summary here comes from the research exercise, the partners for which were that first slide, all of the different universities. And what we did was talk to and interview and survey a number of different local authorities throughout the United Kingdom about how they handled their local procurement and what they thought was going to be the most important thing in terms of their own local procurement capacity moving forward. And so a couple of things come out from that research exercise. One is that social value is viewed by some experts as a much lower priority than addressing other procurement challenges. A lot of these are around staffing levels and the capacity to understand social value as a sort of key element in the procurement exercise. We also saw a great deal of variation in terms of locations that are better positioned than others to link procurement to wider spending, particularly as that is sort of policy defined. We see that there's evidence of enthusiasm amongst procurement practitioners, and then examples of promising practices beginning to emerge. But that was sort of counterbalanced by evidence of skepticism, particularly around the implementation challenges of making social value a meaningful lever for both local and central spend moving forward. And in particular, there was a concern about the limited transparency of social value, both in terms of what's included in the actual contracts, but also the degree with which that's not just delivered, but delivered to a high quality, right? And that goes back to this, well, if that's the lemon, how do we begin to make lemonade from it? I can go to the next slide. So one of the sort of enabling sort of factors that we looked at was the degree with which there was legislation or wider outcomes frameworks available. This slide is wordy, so I'll be quite brief here. What we're trying to understand is that we talk about social value as a generally understood and sort of universally defined concept. But actually, when we look at the records legislatively, we see a huge variation, not just internationally, but within the United Kingdom itself, right? And so the way that people conceive of and frame social value is hugely different in places like Scotland and Wales than we see in England. And that's chiefly because we see sort of procurement-focused social value legislation and policies that are distinct in Scotland and Wales from England and Northern Ireland. And we also see a national outcomes policy agenda expressed in legislation which has a sort of democratic anchorage component to it. And so we need to be clear about how social value functions, not just as a concept, but in its implementation, depending upon what jurisdiction we're operating in. For brevity, I'll go to the next slide. And then I just want to circle back around to this idea that social value is not widely thought to be the sort of most important issue coming up. So this comes back to those conversations I talked about in terms of surveys and interviews with practitioners. And so, you know, if social value isn't the most important thing, what is? This is just to underscore sort of the specificity of what the panel of experts that we worked with sort of over a number of different surveys identified. And in particular, what comes across is this personnel component. It's staffing levels, capacity development, that capacity sort of as defined by an ability to collaborate and communicate within local government teams themselves, as well as with externals. Ongoing professional development, and then really the sort of contract oversight, management, and governance, right? That the procurement exercise doesn't end at contract award, but there's a whole host of different skills that need to be sort of better built into personnel after award and through that sort of partnership of delivery. And then as has come up previously, there's a huge amount of flexibility available in rules. Writing new rules doesn't necessarily mean that that flexibility is actually utilized. And so there's a real sort of need to uptake some of those flexibilities and perhaps build confidence amongst practitioners to actually wield those flexibilities in the rules. So I'll pass back over to Roy.
Thanks. So let me try and wrap this up by highlighting that there's a bill before Parliament that's about public procurement. That's linked sort of the post-Brexit reforms. And so we have a number of suggestions that may be helpful for policymakers to address this issue of lack of transparency. And those suggestions include the transparency notices that are published. Those could have a description about what social value is going to be included in that, whether it's a focus on VCSEs or it's a focus on, what are the environmental policies. That would help people understand what procurements are happening and where the social value is there. There's also talk about having more data on KPIs published. So if a large strategic supplier is including social value in commitments in their awarded contract, we suggest that there could be a KPI around the social value piece, and some of this would involve expanding the open contracting data standard to include lists of lists. So lists of being able to, whether it's the UN Development Goals, Sustainable Development Goals, or it's the framework that Scotland has. So there are there are things that we could do fairly soon to help unpack some of this transparency stuff. The transparency notices, for example, will be in secondary legislation. So that's a suggestion. But to underscore again, the big thing that I think would be most transformative is addressing capacity and staffing issues. We all know that there's been a real hollowing out of local government in particular, and the skills to be able to work collaboratively and to be able to engage and do all the kind of work that people here have talked about. That capacity needs to be built in again to local government. Thank you.
Great, thanks very much, Rory. We could have been here for hours because there's so much in all of these presentations that's been absolutely fantastic. And I'm sorry that we've had to cram so much into such a small piece of time. But I do have a question for the panel, but I'm going to forego that because I want to hear from you and your questions. Now, I know that two of our colleagues are collating the questions online and the questions from the venue itself. Are we ready, Rory, are we ready to pitch some questions to the panel? What I ask is not everybody speaks, that we try, and if there's three of you in one group that have been there, maybe you select one of you to answer the question, otherwise it'll get, and please be concise, please. Thank you.
Do you want to try and identify?
Sure. Thank you so much all for the questions. Apologies for the wait. I see that Caroline Nicholas has posted quite a few questions and comments. Caroline, would you like to unmute yourself and ask a question?
Sure. Thank you very much. I'm in Vienna, and we're just having a thunderstorm, so if the connection goes, apologies for that. I think some of my questions actually been followed up really with later discussions because I posed it earlier, but it goes back to sort of incentives to engage in social value, because we know from other policy making that procurement officials don't want to do things that cause trouble for themselves. I don't mean that in a negative way, but you can't get your procurements done if they're constantly being challenged. So one of my concerns is where we're looking at added value. Is this more risky? Do we think we have the tools that would allow officials to engage in this? That we heard about the priceless presentation and the authorizations. Are those the best tools that we have to try and encourage people to take up these social value contracts? Thank you.
Thanks, Caroline. Rory, do you want to, some of our panel want to answer that?
We could, sure. Does anybody want to answer that? And maybe, or we can collect more questions.
Okay.
If there are more questions.
Yeah. Okay, let's get a couple more questions. And for my speakers online, if you would like to use the button to put your hand up if you want to contribute to a question. Right, have we got another question there then?
So I was just wondering if there was any thoughts around the public perception of pursuing social value and no cost procurement over pursuing lowest value procurements.
Great question. Did you hear that online okay? Yeah, great. Any other questions?
Yeah, I'm sort of, albeit a very small scale commissioner within the big realms of central government. I'm very keen on that sort of approach, working from transactional to partnership. What I found, and we've got tenders out, and we generally only use 20% on price, so 80% is up for grabs on what really matters. And one of the recent exercises, we try to move away from performance indicators to social outcomes. And when we spoke to the market, it was quite surprising for me how the market reacted when we said we want to remove some of the KPIs, because they want to hold on to them and they want to say, oh, but I want to meet KPIs. And we are like, no, we want you to meet social outcomes. So great to have some providers on the panel. So I'm just really want anything you can give me to help, help the provider base to move along. Because, we've heard a lot about how policy needs to change, how commissioners need to change. I want to change the market, but the market is kind of not saying they're traditionally wanting KPIs, and we need some KPIs. But when I tried to introduce the concept, it was a bit like, oh, you can't take that away. We need it. So anything from the provider side would be helpful for me.
Thanks. That's another great question. Are there any more questions online that we want to highlight?
Yes, perhaps we can ask Graham Rados and Andrea McQueen to unmute themselves and speak, pose your question, just in that order. So Graham first, then Andrea.
Hi there, thanks for that. I was just posted a question about prioritization of different social issues. put my video on. I'm not actually at the beach, I'm afraid. Yeah, I posted a question about prioritisation of different social issues, and it seems to me that wages across the social care sector are very low. So why isn't that more of a priority in procurement?
Thank you. And Andrea?
Hi, yes, my great presentations, everyone. I had a specific question in relation to Sandra's presentation in terms of this idea of the priceless procurement and whether or not there was any insight into how a contracting authority would actually go about then determining which bidder is offering the best social outcomes as part of their tender.
Thank you. Claire, back to you.
Okay, well, shall we start off with the panel and who would like to take our first question? Is there, could you feel that they were already to the panel? And then, as I say, if our speakers online want to put their hand up.
And panel members can select a question to answer. If you can answer many of them, that's wonderful. And or if you want to comment on any of the anything you've heard today from others, that's very welcome. Let's just start over at the other side, maybe. Julian, do you have any comments?
Yeah, I'd like to pick up on the priceless procurement idea.
Do you need your mic?
Sorry, you said it. Thank you. I would like to pick up on the priceless procurement idea, and I do need my mic. That's very interesting, and it's an idea that's come up from time to time. So I remember, I'd say at least 10 years ago, or maybe just short of 10 years ago, someone from Sweden talking about exactly that process, the competition on the quality and the social value, you might say, as opposed to the competition on the price. So that's and one of the many frustrations is it comes into focus. There's a good example of it, and then it drifts away again, and it doesn't get captured as a idea that. As a mainstream idea, let's say. It also illustrates one of the points that I was making, which is that if you're thinking in terms of partnership, if the commissioner is thinking in terms of how do we secure best value and the provider is thinking about how do we deliver the best purpose, then you can talk about what the resources are that are available. And you can be realistic about what the costs are. And you can say, and what is the fair pricing of the contract? You can bring all of those things into the picture, which is quite akin to this concept of the priceless approach, where you're, as a partnership, as a collaborative exercise, looking at what we have, what we're trying to achieve, what we have available to achieve it, and how best to do so.
Thank you.
Yeah, I'll have a go at the kind of collaboration for commissioners. It's a shame we haven't met before. You sound like an ideal commissioner, and we should have been working on this market engagement for the last year. But I'll start there. I mean, I think it's leaving a long enough leading period to kind of have conversations and socialize some of these ideas. And it's interesting. I mean, public procurement at the supplier end is dominated by really large actors that have been in that game for a long time and are actually quite kind of agnostic when it comes to what they're working on. You know, we were involved in the first wave of probation outsourcing in the mid-2010s, and you had people that were delivering facilities management in prisons getting into kind of human services for the first time. And actually, sometimes those types of organizations are the people that really value KPIs because it helps them understand and structure contracts, as opposed to getting a conversation about what is it that we're trying to achieve here and how do you really try and capture that in a contract. And sometimes those KPIs measure and value the wrong things. I think that's kind of centrality of the debate. So I suppose that the only kind of core advice is having a long enough leading period to kind of build a sense of who are the ideal actors, what are their kind of philosophies, where are their alignments, what do they know as a kind of subject matter expert when it comes to this stuff. And then when actually trying to bring that into contract, I'll try and think of some quite practical points. So we've seen KPIs designed at a fairly light touch, and actually scoring is done on that kind of 80-20 basis, but even defining quality becomes quite hard and becomes quite contested. And arguably, we've done things that have been, in our opinion, or better quality than what the KPIs are actually incentivizing. So the KPI is stuck around an input. This is the number of hours we want you to deliver per week, or this is the type of engagement within a 24-hour period we want to see, as opposed to this is the outcome of that particular engagement, and this is the impact that that engagement leads to. And so I think it needs to kind of be an evolved conversation, hopefully one that matures depending on the particular points. I think just quickly on the question about price and social care, salaries and social value, it's really important to discern differences between broader social benefits versus the kind of the intrinsic benefit of delivering a public service, and actually questions of salaries and wages, which I think are a big problem in public service outsourcing that has been incredibly squeezed by a number of years of constraint, like fiscal constraint. And so when we're talking about prices in particular sectors, be it teaching or prison officers or social care workers, in my opinion, that's not a social value issue, that is a pricing issue. And the pricing issue flows from a broader kind of spending review and fiscal settlement, and indeed the public sector pay awards. So I just wanted to kind of put that out and try and clarify that.
Yeah. Can I just come in, because one of the interesting questions is around public perception of social value, and if the lowest value is more appealing. But we have to say, if we have known for years when we talk about low value contracts, does that really, those savings from that, do they really pass on to the general public? Or if we have social value and have the frameworks, we've seen a number today, and government has its own framework, if you want to look at that, 06/20 on the government website. If we have frameworks that look at different social value interventions, is that the best way? So, but that question's come up. So could members of the panel have a look at that? And Raquel and Martin, what your thoughts are? Martin, would you like to come in first?
Oh.
You go on, Raquel. You've unmuted.
Well, I will speak from my experience here in Portugal. We have a very low awareness from public regarding these outcomes. So this relies upon that the fact that the public contracts are not monitored. Once the monitoring phases of contracts are applied and the results are seen, I believe the citizens will be much more aware, and therefore there will be a pressure to the market to assume those kind of contracts. So here in Portugal, if we talk about priceless PPP, that's strange for the market, you know, because most of the economic operators are still thinking about PPP equals money. Okay, so the cost and the gain is money, and they don't think about gaining other things, even environmental things. Well, we now are starting. Social ones is very, very difficult for now. So I think we must, public policies and the governments should be thinking about teaching the civil society, because that can be a very pressure focus on economic operators and the market.
Thanks, Raquel. And another question was really about behavioural change, and that I think was KPIs versus social outcomes. And what we know is that we have to do behavioural change, because we know that when people have always done it that way, then they want to continue to do it that way. And one of the points I've put to our strategic suppliers who have to within our contract, because social value is in all our contracts, 10% minimum. So they have to, if they're going for a contract, it has to be integral into what they put into us. But one of the questions I asked them, do they do social value just for government contracts, or is it part of their wider commissioning that they do in their contracting? It's a bit like having a puppy for Christmas. So to the panel, anybody want to talk about how do we start with the behavioural change that will lead to a better understanding of the benefits of social and environmental value.
I think it's the disparity between the procurement teams and the top management, because somehow it's a belief that top management, they understand pound sign better than anything. So we need to, somehow bridge that gap between the top management and the people who are working for the supply chain. Because what is happening in the real scenario, that top management, of course, everyone loves social value, the purpose-driven companies, what we are operating, but pound signs takes upper hand. And we need to just somehow upskill our people and need to educate them that we need to work around social value. We need to work around sustainability, but then how we can actually work towards sustainable saving. And maybe just I will end this by one example, because personally, when I started my procurement career, it was all about, that traditional approach. You need to work around cost saving. You need to work around cost avoidance. But then I learned one thing. It's also about how you are spending money. So we need to teach our procurement more about sustainable spending rather than always cost saving. So that's what we need to address over here. So yeah.
Thank you very much indeed. So I'm sorry, but I'm going to have to round this up now because we're just towards the end. Can I please thank all our panelists, and maybe you can give them a round of applause in the auditorium there for some insightful presentations. And I hope this discussion just doesn't end here, that we can further listen to what we've got to say, because collaboratively we can move things, move this agenda forward. Also, thank you to the team at GoLab for putting this on today. Last year, a final thought from me, last year at COP26, I was listening to one of the presentations and I listened to this speaker and his interpretation of what he said, and it's something that was in Rory's presentation, was about leveling up. And what he said is that leveling up means we need to have a new economic paradigm shift, and social and environmental value gives us the opportunity to measure other than profit and GDP. And I think those words have stayed with me since last year, because we have to do much more with all the challenges that people are facing at this moment in time across Europe and especially in the UK. Thank you all very, very much indeed. It's been great to listen to you today. And hopefully, speakers, you can answer some of those questions on the chat, etc. And wish you all a safe afternoon, and if you're journeying home, a safe journey home. Thank you very much indeed.
Thank you very much, Claire. For those in the room, I think it's time to go and enjoy some libations, I think, and we can continue this dialogue. For those of you who've been online, thank you very, very much. Everyone is very welcome to join the Oxford Pogo Club, where we can talk about these things and others. Just shoot me a note. The information is on the website. But thank you very much, Claire. Thank you very much, all the speakers, and thank you very much to all the participants.